Everyone wants to look their best, so having a scar can be devastating, especially if it's in a very visible spot on your face. But what can be done to prevent or minimize the looks of a scar? We spoke with Dr. Ronald Moy, a renowned scientist, researcher, dermatologist, and cosmetic surgeon who spearheads a thriving dermatology and cosmetic surgery practice in Beverly Hills. We asked Dr. Moy, where do scars come from?
Scars come from trauma or surgery. Scars sometimes occur from things like acne or cysts, but there's a lot of different ways to get scars. Curing scars, we do scar revision techniques. I do plastic surgery techniques. We laser resurface scars. We treat scars. We inject scars with steroids to flatten them out. So that's really the treatment of scars. But the prevention of scars is really what we're talking about. And scars, some people are more prone to scars. Some people get scarring because, maybe bad surgical technique where the skin doesn't match and it's uneven, and that's why you have to suture very precisely. But you can prevent scars by keeping the skin well hydrated, and that's why many of the products that are available are silicone gel sheeting. Now, our product contains two main ingredients. We have the silicone contained in there, which does hydrate the scars, and then we also have DNA repair enzymes, because scars are abnormal tissue. Scars are collagen that have been damaged, and so you get this thickened abnormal collagen. And so DNA repair enzymes actually help repair that damaged collagen and prevents some of the scarring, treats some of the scarring, makes the scarring not as bad as it could be. So we have found that using the DNA repair enzymes within a scar cream is very beneficial at prevention of scars and treating scars.
Does your product, DNA Repair Scar Cream, have a different formula than other scar products?
It does have a different formula. The main thing is it contains the silicone within it, and that's what all the other skin scar products contain. So it's a combination of the existing scar products and DNA repair enzymes. Currently, I would recommend using it after the wound is healed, and that will prevent your scar from getting worse. Often we tell people that it can take 6 months for a scar to fully mature before we treat it. So we would argue that putting the DNA repair enzyme creams on should be done for a couple months, and that will prevent your scars from getting worse. Generally, we would recommend somebody to use DNA repair night renewal or DNA intensive renewal all over the face at nighttime. During the daytime, we recommend everybody to use a good broad spectrum sunscreen. Now, sometimes people will add DNA intensive renewal because it does have actually a photo activating DNA repair enzyme that can help. So you can combine that with a sunscreen during the daytime. But I think nighttime is the usual time, and just a really thin film all over. DNA intensive renewal is a serum, so it spreads very evenly. DNA night renewal is a thicker cream for people who have drier skin or someone who's on the older side who has a little bit drier tendency, so that goes on over, but you don't need a lot.
Where do these DNA repair enzymes come from?
We all have DNA repair enzymes. So I have DNA repair enzymes in my skin, and that's why I don't get skin cancers. There's actually some children who don't have DNA repair enzymes. Their syndrome is called xeroderma pigmentosum, and they start getting skin cancers at an early age, like 4 or 5. They usually pass away from their skin cancers going. And in fact, one of the studies on the use of DNA repair enzymes was on these children. It was published in Lancet, and they showed a 50% reduction in skin cancers, melanomas, basal cell carcinomas, actinic keratoses. All the different skin problems they get were reduced by using these same DNA repair enzymes that we're using. So everybody has them, but plants have them, plankton has them, bacteria, they all have DNA repair enzymes. So every organism is damaged in some way, and they have DNA repair enzymes. So the source that we get actually is from plankton. We get some from plants, and we get some from bacteria. Those are the major sources. And then we put the DNA repair enzymes in liposomes, which allows it to absorb into the deeper part of the skin. So it's all from natural sources. It's all something that we get really, and they're natural ingredients.